Well, as a mom and as every other mom I know, I'm sometimes completely overwhelmed by the health information I think I need. I try to do everything for my kids to keep them happy and healthy, and there's just a tremendous amount of information to sift through. So when I looked on websites and looked out for information, I often found myself really struggling to try to put together the different pieces that were out there. And I really hoped and wished for somewhere that would pull all that information together for me. Well, recently, my younger son turned 5, and I noticed that he was starting to grow out of his car seat. And I went on the CDC website to look and see how old should he be, how long will he need to sit in a booster seat, all those kinds of questions. I did get the answers to my questions, and then I also started looking up what other developmental milestones should I be looking at for a 5-year-old? What else should I be thinking about and getting ready for? As a mom...
What did you decide about the car seat?
Well, I decided to get a booster seat that was going to last for a few years because I learned that he really needs to sit in a car seat until he's probably close to 8 years old. So I invested in a good high-quality car seat that would last me that long. Well, as a mom, I don't have a lot of time, but I always have an opinion. And if I'm asked, what is it that you want to know about to help keep your family safe and healthy, I'll tell you. Every mom I know will share information with their friends and their other moms that they hang out with. And I think that public health needs to really access moms to go to where they are, to listen to them, to ask them for the information that they're looking for and that they're hungry for. And involving moms in helping to develop that information is the most important thing that as a health educator and health communicator I would suggest doing. I think that helping to pull together information in a package that's designed for the way parents search for information. As a mom, when I have a 12-year-old who just started middle school, I know there's a whole bunch of new environments and influences that he'll be facing, and I want to help equip him to face those challenges. He's going to start to take more risks. He's going to hear about new things. I would like to get all of that information together in one place and not have to go to one place to learn how to talk to him about how to resist the pressures of smoking, for example, and go to another place to talk about other kind of risk behaviors he may hear about. As a mom, I just want it to be made easy for me. Well, you used to have to go on CDC's website and search hundreds of pages to get to everything related to a child of a certain age, for example. And worse than that, you'd have to know what you were looking for. The way that the portal has been redesigned in this first step, and it's just a first step, is by grouping the information together by the child's age. And that was based on asking moms how they wanted to look for information and how they wanted to get that information. So now, if you go onto the CDC's parent portal, if you have a 5-year-old, as I do, or a 12-year-old, you can go in and look for what are the things that I ought to be worrying about at that point. And as a mom, I worry all the time. Every mom I know worries a lot. And we want to worry about the right things. So helping to package that information so that it's all together in one place and you can go and see what it is you need to be thinking about and need to be worrying about, that helps us. It reduces the possibility that we'll spend time worrying on something that we really don't need to worry about. There are a couple of really popular places that are accessible on the parent portal. Immunization charts are there. Height and weight tables are there. That's something that a lot of moms are worried about now. We hear so much about how early childhood weight problems can lead to so many health problems later on. And so the parent portal does list those really popular links that lots of people know they need to look at in an easy to access place on the page. Yes, there are lots of links that are really helpful that way. There are positive parenting tips. You know, the Centers for Disease Control and Prevention is very focused and receives its funding based on how do you prevent diseases and conditions. But there are lots of positive parenting tips and things that we can do that will help our children grow up healthy and happy and help them to get to their very best potential. And I think those kinds of positive parenting tips can be really helpful in helping guide us to what we need to be thinking about. Well, the people that I've talked to are really grateful about it. I think that all of us know we have a lot more work to do. One of the things that I think is really important for parents is to make the information very easy, to write in plain language and make it simple for all of us moms to understand. I struggled recently with a prescription label for something for my 12-year-old, and I know how hard medical information can be to digest. So I would like to see all of the health information be in that plain language that's very easy and simple to understand and easy to translate it to action. So tell me what it is, exactly what I need to do, and I'll be happy to do it. And the reaction to the webpage has been, this is a great start. Let's see even more of this in that very simple, plain language. Every mom I know, before they pick up the phone and call their pediatrician, unless it's an emergency, they go on the internet. It's like going to Dr. Google. You go on, you type in a few words, some sites come up. If you're lucky, you get to a site that really has good, credible information. But women, moms and dads are going into the pediatrician's office now armed with a lot more information than they used to do. And so making that good, credible information easily available to moms, I think, is really important. Yes, at the top of the Parent Portal site, there's a features box, and that features box has changing information in it. Sometimes it's just something we think that people might need to be aware of, but other times it's breaking news. So for a while now we've been featuring special information on H1N1, swine flu, for example. And I think that's going to be really important for moms because we listen to the news, we hear rumors, we hear information all the time, and we really need to know where to go to get the latest, most credible information. So we're going to try to keep that features box up to date for what moms need to know.